is CTV's W5. Here is Lloyd Robertson.
Welcome to W5. The ads are seductive, promising body beautiful in a flash of light. You'll find them on the internet, in newspapers, and at beauty salons pretty well everywhere, offering quick and easy hair removal, skin tightening, elimination of blemishes and wrinkles. At the heart of it, powerful laser machines with rays of light that blast the skin. Laser treatment is the fastest growing cosmetic procedure in Canada. But a W5 investigation has found that those beauty treatments carry significant risk. The lasers are medical devices, but virtually unregulated. No one is checking on the machines or who uses them. And as we discovered, it has led to some horrific injuries. Dermatologists are now warning Canadians, don't get burned in the quest for beauty. Here is Beverly Thompson.
Allow me there.
We're wiring up.
See that record light right there?
Emily and Aislinn work for W5. They're taking hidden cameras into beauty salons, going undercover to investigate risky laser treatments.
Well, it is not too much of a burning. It's a little bit of heat sensation.
It's 50% off right now. 50% off right now.
The pitch is hard to resist. Smooth, hairless, flawless skin. Online, everyone's seen the daily deals. Once limited to dermatologists' offices, cosmetic laser treatments are available everywhere.
Still good?
In Toronto, dermatologist Dr. Lisa Kellett uses them every day.
They're phenomenal. Like for certain medical issues, brown spots, spider veins, wrinkles, hair removal, pore size, I mean, they're fantastic. Okay, so this is the light shear here.
At Dr. Kellett's clinic, there are 6 different lasers. That's how many she needs to treat patients safely.
So this laser we use for very small areas.
They're effective and powerful. But put a laser in the hands of someone without the right training, and things can get ugly fast.
So this, to me, was startling.
So this looks like pigment change.
Laser treatments are completely unregulated. Anybody can use a laser. You don't have to be a doctor or have any medical training.
You know, it's so common, and we see them every week.
How many times a week would you?
I usually see it about 3 or 4 times a week.
3 or 4 times a week? Somebody is walking in your door with damage because of some kind of a laser problem.
Yes. It's incredibly frustrating because there's no regulation.
In Guelph, Ontario, Deirdre Douglas discovered this the hard way. A former fashion model, she works hard to look good. After 2 kids, it was getting tougher to stay trim.
What was your biggest complaint then?
My stomach, and it wasn't as tight as it was before I had a 6-pack ab.
Really?
I did.
Lucky you.
Deirdre wanted to try laser skin tightening. She found what looked like a great deal at Phoenix Laser Spa, just outside Toronto. And this looked promising. Certified laser technicians.
I looked on her wall. She had a certificate hanging from a laser center. I guess she had been certified.
White skin.
Deirdre will never forget what happened next.
She zapped me. I nearly jumped off the bed. I felt an actual volt of electricity into my body.
You must have screamed.
I was screaming. I was.
And what did she say?
Oh, it's not supposed to be that painful. Even after I said no, not to do it, she still took the laser and she kept zapping me. So then at that point, I took her hand off of my stomach and removed it. And I said, no, I can't take this kind of pain anymore.
So it was burning.
It was burning. It was like burning on fire, burning.
Deirdre took photos.
What a nightmare. All those marks?
Yeah, these ones here.
So that was all the places that she put the laser on?
These ones were the really bad ones right here.
Deirdre says she was never informed about the risks or side effects.
So you're ready?
So we wonder, how are these medical procedures sold to you at beauty salons? That's why our undercover shoppers, Aislinn and Emily, are booked for a special appointment.
We're here to see Dr. Kellett.
And she's expecting you just right up the stairs.
Super, thanks.
You're welcome.
Before they head out for their secret salon survey, Dr. Kellett will give them a proper medical consultation. They will ask about the most popular laser treatment, hair removal. Emily's diagnosis?
There are some types of laser hair removal devices that would not be appropriate for you because you have a significant risk of pigment change if we were to use that device.
And what about Aislinn? Dr. Kellett spots a potentially dangerous risk factor.
I noticed that you have an allergy to penicillin, you're allergic to shellfish. So let me ask you, do you have eczema as well?
Yeah, I do.
Your history of eczema makes you more sensitive to the procedure. Why don't you show me your legs?
Sure. They're hairy. I will tell you that.
And now, the hands-on test. Aislinn's leg hair.
Okay, so this is good. This is, for one of the lasers, we have something called Light Share Duet.
Okay, do it.
Kellett recommends different lasers for Emily and Aislinn because they have different skin types.
All right.
On our secret survey, we pick a random sampling of salons in Toronto. And watch this. On hidden camera, some technicians tell us one machine can do it all.
For all skin types. It's for all skin types?
We show Dr. Kellett.
It works on all skin types, even the dark African American, darkest skin types.
They were told one thing, one device, one-stop shop, it'll do it all for everybody, no matter what skin type.
It's difficult to have one device do everything. For us, it's a safety issue.
Sorry, what kind was that?
And what about the side effects?
The most common risks include scarring, infection, pigment change, and burns.
On hidden camera, most salons we visit tell us there are no side effects to worry about at all.
And there's no the side effects?
No side effects. No side effects.
There's been no long-term side effect have been registered.
Especially in your situation, there is absolutely no side effects.
You have my darker skin.
And with your dark skin, we have technology that actually, it says here, no burning, no scarring, absolutely safe.
Absolutely safe and no side effects. In some cases, they weren't saying just low chance, they're saying guaranteed. Who offers guarantees?
Not a physician. There's no guarantee to anything in medicine. It's very important that patients know that there are risks to every procedure and that they're aware of it.
As laser treatments have become more prevalent, so have the horror stories. These are patient photos sent to us from Canadian dermatologists.
So just how bad is it? That's the problem. No government agency is keeping track. Some people end up going to a dermatologist to treat their burns and scars. That's why we asked the Canadian Dermatology Association to survey its members. How many of them have treated patients injured from laser treatments? An astounding 73% of dermatologists surveyed.
Cases like Deirdre's. After getting burnt, Deirdre did some research. She learns the machine used on her stomach is not recommended for dark skin. She emails Lorraine at Phoenix Laser Spa.
And how did she respond to that?
I'm really shocked. I have mostly dark-skinned people. That's why it's so strange.
So we wonder, exactly how is Lorraine at Phoenix Laser Spa selling her laser treatments? Our secret shopper, Aislinn, books a consultation with her. The salon is behind Lorraine's house. Aislinn heads in with a hidden camera.
Good morning. Hi, sorry I'm running over the time. I'm Aislinn. I'm Lorraine. Lorraine.
Aislinn isn't prepared for what she hears next.
Can I ask you who your pain tolerance is?
It's okay, I guess. What is considered average?
Had Tylenol with codeine?
Yeah.
Laser treatments aren't supposed to hurt. So why does Lorraine advise Aislinn to take pain meds?
But you suggest I take Tylenol with codeine before the procedure?
I would say, so I could give you better results.
Okay, because I can tolerate more pain? Or?
Yes, and it'll work better.
Okay.
It'll work better because I can up the power.
And this is the most surprising part. Remember, Lorraine told Deidre her laser machine is safe for dark skin. Looks like she's changed her tune.
No,
Like,
hair
if I
removal?
brought my friend, she's darker skinned.
Yeah.
Does it work for her? Or?
No, the skin tightening is too strong. See, like, it's too strong for darker skin. Okay. I wouldn't chance it.
But she did chance it on Deidre.
You went to somebody that you thought you could trust.
Right, somebody who I thought was certified. She's still out there doing this, and she shouldn't be allowed to.
We've made repeated attempts to speak with Lorraine at Phoenix Laser Spa. She declines to speak with W5, so we drop by for a visit at her backyard beauty salon.
My name's Beverly. I'm from W5. Hi. Hi, I just wanted to ask you about your qualifications for the medical procedures that you're doing at the spa.
Okay.
Can you tell me how you feel you're qualified to do the procedures, for instance, with laser?
I've had no complaints.
Really? What about Deidre?
And you told one of our producers who came to see you that you wouldn't do laser on black skin.
Not after her.
Do you feel like you have the qualifications to do this? If somebody's been burned as badly as she
It's not that bad. It's not that bad. And it didn't happen until after.
Permanent scarring.
It didn't happen until after. Like, this is the beginning when I first opened my business. Sometimes stuff happens.
She told us that she was in pain and that she told you to stop.
No, that's her word against mine. It was just a freak thing, and I apologized to her, and I said, I don't know how this happened, honestly, and I do think I'm qualified. I do it on myself all the time. I've done it on people with oriental skin type, and there's no problems. It's just that a lot of people know, like, you should always research things yourself.
Lorraine is certified, but as we found out, that's not that difficult.
Next,
I didn't want to go out in public.
big heartache, little training.
This might be something they would put on the wall.
Very misleading.
Is 1 hour all it takes to become a laser specialist?
Do you think that people are qualified to use the machines after an hour of training?
When CTV's W5 continues. In just a moment, see how anyone can get their hands on their own laser machine.
This can cause injury, no question.
We'll be right back.
We're testing powerful laser treatments. The promise? Smooth, hairless, beautiful skin. But in the wrong hands, the results can be ugly. Burns, infection, and permanent scarring.
You would call once a week.
In London, Ontario, we meet Catherine Malcolm, a 20-year-old university student. A year ago, she signed up for laser hair removal on her upper lip. Every morning, she uses heavy makeup to mask the damage, but she can't ever fully hide the effects of a laser treatment gone terribly wrong.
What did you think when you looked in the mirror?
I was just devastated. I was very, very self-conscious. I didn't want to go out in public.
These photos were taken a few days after her treatment.
And you're in pain the whole while?
Mm-hmm. You felt like a throbbing pain. And then I would get a burning sensation. Still to this day, when I exercise, I can still feel it throb.
And who's responsible for her scar? Not a beauty salon, someone you would never expect. Catherine went to see Dr. Tariq Farouk, a family doctor in Barrie, Ontario. One of his staff performed the treatments under his supervision.
So when you woke up that next morning, it was infected. You went right back to him. Mm-hmm. What did he say when he saw it that time?
The reaction I remember is, oh, that doesn't look right. And I was like, of course it does not look right.
Dr. Tariq Farouk has denied W5's repeated requests for an on-camera interview, saying he can't comment because of patient confidentiality. Unlike technicians at beauty salons and med spas, doctors can be disciplined. After learning of other complaints about Dr. Farouk, the College of Physicians and Surgeons is investigating allegations of incompetence, and misconduct. At Sunnybrook Hospital in Toronto,
There's a lot of warnings on the outside of this room.
Well, people don't read signs, so hopefully we do our best.
we meet Dr. Howard Bargman.
So we also have a fire extinguisher hanging on the wall here.
He's a dermatologist and the hospital's director of laser safety.
So everybody has to wear goggles when they're here in the room. The goggles have to state the wavelength that they're protecting you against.
Okay.
This is calibrating the laser, making sure that it's going to fire at the energy that we have determined.
He knows just how dangerous these devices can be.
So we've determined that everything is ready to go, and on the count of 3, 1, 2, 3.
Wow, just feels like a cold spritz of air.
Well, it was a laser, but this...
Bargman audits physicians' laser use and finds even MDs make mistakes. And he makes a startling confession.
I have, over the years, caused minor injuries to patients. It's inevitable, as careful as you try and be. So I don't want to stand here and say I've never injured a patient. But at least if I do, I'm prepared to look after them for that injury.
Cosmetic laser treatments are high-risk procedures. So why doesn't the government regulate who can use these machines?
There are no government requirements to operate these lasers.
That must be astounding to you.
Well, I've been trying to correct that for a decade.
Anybody listening?
No.
So if there are no regulations, how easy would it be for W5 to get certified? Online, we find the Alita Laser Center. They offer hands-on training and the chance to become a certified laser specialist. We send in our producer with a hidden camera. How long will it take for us to get our hands on a laser machine and on a certificate? Tanya Reckman is the instructor.
So there's a little button here. And if I press it and hold, it will show. See? Oh, neat. So I'm keep pressing. If I'm gonna release, it's giving me the sound, it doesn't shoot anymore.
For just $350 a day, Tanya says we can rent one of her machines and start our own treatments.
And how many people do you rent this out to? Oh, I have lots of people there. Really? Yeah. Yeah, there's lots of, some people are having contracts, they having all the time machines. All the way up, then churning.
After about an hour of instruction, Tanya Reckman, president of the Alita School of Laser and Advanced Technology, awards us our Certificate of Completion. So we arranged to meet Eddie Reckman, Tanya's husband. Now that we're certified, we can rent our own laser. He's got the machines in the back of his van. After the drop-off, we deliver it to Dr. Bargman. We ask him to inspect our rental.
See, it has the wavelengths, the power, the frequency. This can cause injury, no question. I personally would never use this without adequate training.
And what about our training?
She received the certificate. It was inside of an hour. There was nothing written. And now she's a graduate of the Elite School of Laser and Advanced Technologies.
I would never treat someone having been instructed for an hour on this machine. And I've been doing this for 15 years.
This might be something they would put in a frame, put on the wall, and give people confidence that they know what they're doing.
Very misleading.
We show Dr. Bargman how the filter is literally taped to the handle.
They've taped that all up.
That's encouraging, isn't it?
Here's why. On hidden camera, Tanya tells us to make sure the clients open their legs wide or else.
Yeah, so you can burn the person, not with the laser, with the metal part, yeah. So be careful. Once it fell down, but now I'm always putting the tape.
Badly maintained machines and questionable training. This is what happens when these medical treatments aren't regulated.
There's no set rules for the lasers here. There's no regulations. This is like kind of weird, you know? That's interesting. That's interesting, yeah. Very interesting.
No more undercover questions. We reveal who we really are. and make repeated requests for an on-camera interview with Tanya Reckman. She declines. So we visit her at the Alita Laser Center.
Are you Tanya? Yeah. I'm Beverly Thompson from W5. I wanted to ask you about your laser training.
No, I'm not gonna do that.
Well, can you tell me though, do you think that people are qualified to use the machines after an hour of training?
It's not fair. I didn't agree to this.
Behind closed doors, Tanya wants to know why all the concern.
What the reason for this segment?
Safety.
Safety.
People are getting burned by these machines being operated by people who don't know what they're doing.
Everything can burn people. You can be hurt by ironing, you can hurt yourself.
But this isn't a household appliance.
That's right, it's a medical device. Eventually, she admits our producer should have had more training.
You should practice. You have to know what you're doing.
So she shouldn't have that certificate?
She shouldn't have the certificate, yeah.
You still treat people who come into your clinic. We talk to people in your clinic who have seen people who come in with all these damaged faces.
It happens frequently.
And you can rent this like that.
Unfortunately.
So, Beverly, regulation is the question. Who's going to do it?
Well, right now, no one is taking responsibility. We went to Health Canada. Health Canada pointed the finger at the provinces. We went to the provinces. They say it's not their jurisdiction. So right now, it's just unregulated.
So what's going to happen?
So it continues. The business continues. This business continues. People can go and get laser treatments. They can become certified and use medical devices on anyone.
So if you're a potential customer, beware.
You bet.
Thank you, Beverly. You can go to our website at w5.ctv.ca for advice and tips from dermatologists on this story. We'll be right back.
Next.
Fauna